vulnerable people deserve safeguards. I was a vulnerable person, and I did not get the safeguards that I deserved.
A young man struggling with multiple mental health issues. He decided to seek help from a gender clinic, but their solution made things 100 times worse. Now, Ritchie is living with the devastating consequences of a decision he deeply regrets to this day. He calls this decision the biggest mistake of his life. Mental health issues and homophobia. Ritchie Herron was struggling with a lot of issues. These included anxiety, depression, and OCD. All this stemmed from Ritchie's internalized homophobia and undiagnosed autism. These challenges left him feeling extremely isolated, so he did what most vulnerable and lonely teens do. He found comfort on the internet, this place which was supposed to provide genuine answers and support, but it ultimately led him down a destructive path. Older men online praised and encouraged him. They reinforced the idea that Ritchie was born in the wrong body. They told him that his age made it a good time to transition. They also said they were really sorry for not making this decision sooner for themselves. This online community of strangers introduced him to gender dysphoria. The discourse of this concept resonated with him. He believed it explained all his struggles. Looking back, Ritchie recognized that he was really manipulated by these online influences and trans narratives. They made him believe that he definitely had gender dysmorphia, and transitioning would solve all his problems. And Ritchie, who was already suffering from OCD and internalized homophobia, readily accepted this idea. He wanted to believe that he is not gay. He is just a heterosexual woman trapped in a male body. And this is how Ritchie, a civil servant with a bright future ahead of him, decided to pursue transition. He started believing that he identifies as transgender and that he should embrace his true, authentic self by taking on the name Abby and going for gender-changing treatments. Intensive therapy and hormone treatment. Online activists encouraged Ritchie to bypass the UK's National Health Service and seek a private diagnosis. This he received in March 2014. He was then referred to the Northern Region Gender Dysphoria Service in Newcastle. The first question asked to him was if he wanted gender-changing surgery. Ritchie was shocked by the question and shaken by the idea. The poor guy had been expecting guidance and support, not a push towards a life-altering decision. Despite his hesitation, he was convinced by his gender therapist that his distress as a gay kid obviously meant he was transgender. According to the therapist, Ritchie hesitated because he had internalized transphobia and a disconnection from his body. Ritchie began attending therapy sessions with a gender therapist every 2 weeks for 5 years. In these sessions, he was made to believe that his struggles were due to gender dysphoria. He was prescribed a testosterone blocker called Zoladex, which stopped his body from producing testosterone and androgens. Ritchie later started taking estrogen. However, he was not fully informed about the risks of hormone treatment. These risks included the potential for infertility, osteoporosis, and increased risk of certain cancers. It took about 2.5 years for his estrogen levels to register within the normal female range, genital surgery, and instant regret. Despite Ritchie's reservations, he was quickly diagnosed and referred for surgery. The clinic told him that if he didn't want surgery, he would be discharged. This pressure, combined with the influence of his therapist, eventually convinced him to undergo the procedure. It was the 23rd of May, 2018, when Ritchie was taken to the operation room to get a vaginoplasty. This is the kind of surgery where male genitals are reconstructed to female genitals. The clinic identified him as an ideal candidate for gender reassignment surgery, but for Ritchie, it was the most traumatic experience of his life. What Ritchie felt immediately afterward the surgery was an instant and crushing regret. He experienced extreme complications, including bleeding, urinary issues, and blinding pain. Later, he couldn't even look at his body without breaking down into tears. Ritchie believes that he was misled by the clinic and his therapist, who failed to provide him with accurate information about the risks of gender reassignment surgery. He felt like he was getting grilled with questions over and over by them. Even though his family and friends had doubts, Ritchie was convinced by online voices and medical pros to go through with it. His mom was especially worried, but she got shut down by a psychiatrist. He was not equipped to make such a significant decision, and that the clinic took advantage of his vulnerability and mental health condition. Ritchie stated that his gender transition had a profoundly negative impact on his life. It caused irreversible harm. It was the biggest mistake of his life. Dismissal and detransitioning. Ritchie visited the clinic after 3 months of recovery from surgery to express his concerns to medical professionals. He told them that he was regretting the decision, but they dismissed his concerns, attributing them to obsessive rumination. They also labeled him with another diagnosis called unstable personality disorder. And this is how Ritchie Herron's 5-year journey at the gender clinic ended abruptly and with a mutilated body. He had about 300 visits yielding devastating consequences. He was left to pick up the pieces of his life. When questioned about their handling of Herron's case, the clinic remained silent, offering no explanation or apology. Feeling silenced and rejected, Ritchie turned to online communities for support. Initially, he found some empathy, but soon realized that the community was more focused on managing his regret than acknowledging his feelings. Ritchie felt like he was living a lie. He began to question the true nature of his journey. He recognized that transitioning had been a form of self-rejection. He had been encouraged to reject his own biology and body. Ritchie's activism for detransitioners. Ritchie could hardly express his uncertainties over his transition in trans places without encountering resistance. He was labeled a TERF. That was until he discovered the detrans community. Here he found others who had gone through similar experiences. Through the conversations with the detrans community, Ritchie began to unpack the origins of his own gender dysphoria. He realized that his desire to transition wasn't about becoming a manly man. No, it was a desire to escape the constraints of masculinity. With this understanding, Ritchie cut his hair and decided to stop living as a woman. However, Ritchie's journey was so far from over. 6 years after his surgery, he still suffers from serious complications. He experiences urogenital disorders and sexual dysfunction. He cannot even ride a bike. His mental health is still in shambles. Ritchie also sued the National Health Service, NHS, for the permanent damage done to his physical and mental health. One of the reasons Ritchie took the NHS to court was that many red flags were missed during his transition. He sought true answers and clarity. For Ritchie, detransitioning means acknowledging that changing one's sex is not possible. He strongly advises against changing one's sex. According to him, it is not natural. Ritchie says this because he has been left with long-term surgical impacts and must take hormones for life. He has a permanent medical reliance now. True detransition for him would mean escaping that medical dependence entirely. Sadly, that's not a viable option since he needs hormones to survive. Ritchie's experience is not unique. A growing number of transitions are speaking out about the harm and trauma they experienced at gender clinics. In response, the NHS has recently, in August 2024, announced a new service to help transgender patients return to their birth gender. Ritchie welcomes this announcement. He is all excited about this new treatment and says he'd be among the first in line to try it out. But he also cautions that the clinic must be staffed by medical professionals who are not the same ones responsible for the harm he and others have suffered. Ritchie's story reveals a shocking truth about the transgender healthcare system. Despite his concerns, he was silenced, misdiagnosed, and coerced into continuing his transition. His mental health condition was dismissed with the overpowering trans narrative. After going through a world of extreme pain and regret, Ritchie Herron is now on a mission to help others avoid the same mistakes. He's passionate about detransition and wants to make sure no one else has to go through what he did. From hormone treatments gone wrong to long-term health issues, he is also dedicated to spreading awareness and support for those questioning their gender identity. He wants all these young people to know that there are other options beyond surgery and hormones. He wants parents to know the right way to deal with gender dysmorphia in teens. But most of all, detransition was a serious topic that needed more attention and understanding. And Ritchie's bravery in speaking out undoubtedly helped others feel less alone. It made them feel more empowered to make informed decisions about their own bodies. Thank you for reading, and before you go, make sure to subscribe to our channel for more inspiring stories and important conversations.